Welcome back. There's nothing worse than spending thousands of dollars on dental work only to continue to have issues that may lead to major oral health problems. Well, Mandeville Center for Dental Excellence operates in excellence and can take care of just about any dental dilemma. Dr. Charles Schof joins us now. And Doctor, today you're focusing on the benefits of dental implants.
Yes, thank you. It's I hate to say it, but a great time to, have dental problems with the technology that we have.
Sure, it makes it a lot easier, right?
Absolutely.
So starting out, let's just talk about what is a dental implant?
A dental implant is a titanium root that is buried in the bone, and we have the option to attach one or more teeth, depending on the situation, to the implant.
And how does getting dental implants help patients?
Well, it can restore a lot of predominantly quality of life. I mean, there are some patients out there that are afraid to smile. There are some patients who have struggled with a denture. Some patients can't even wear a denture. And so, with dental implants, it can open up a whole lot different options, right, for patients to kind of regain their quality of life.
Right.
Beauty, function, health, confidence. Yeah.
A laundry list of pros.
Laundry list.
All right, let's take a look at this testimonial.
Before this procedure, little did I know that my general health had failed, was failing. I had a heart attack. I didn't know that a dental condition could do that to your general health. However, it was doing it to mine.
When I first met Chris, he's a character. Chris was struggling with some health issues with his teeth. And he'd gotten to a point where he realized there was something that needed to be done. And so I think after that happening, it really confirmed, his belief that, having unhealthy teeth can have a negative impact on your life.
His staff was extremely knowledgeable. I was very comfortable with them. They made me feel very, very comfortable.
We were able to, from the time we met to the time Chris had his final prosthesis actually attached to the implants where they do not come in and out, it's about 3 months. So we've got some techniques here that can speed up and get these types of procedures, get patients back into the normal lifestyle and not have to drag it out for 6 to 12 months like we did several years ago.
When the procedure was over, I have really felt tremendously better. I would surely recommend Dr. Schof.
All right, so it honestly looks like you're having too much fun doing what you do, right?
We try to make it,
Yeah.
have a good time.
And obviously you get along with your patients and vice versa?
Like family.
Yeah, yeah, great, okay. And tell us, who would be a good candidate for dental implants?
For the most part, there are a couple of rare medical situations, but for the most part, anybody's a candidate. What I find is that most patients kind of wait too long to come in, and so we need a good solid foundation of bone to be able to set those implants, to be able to support whether it be a crown or a full mouthful of a restoration. So there are ways to, I guess, put the bone back, but it just adds more time and cost to the procedure.
Sure,
So,
okay, and we do have a full screen up here that tells you, who would be a good candidate. So you've mentioned the healthy gums, adequate bone, must commit to keeping the structures healthy, meticulous oral hygiene, and regular dental visits are critical.
Absolutely, yes.
Okay.
Just because you get the implants doesn't mean you're
Yes,
never
this
to
isn't a
return
one
to
and
it.
done deal,
It's
right?
not, no, unfortunately, it's not a one and done deal.
Okay, so how long do these implants last?
The studies that I've most recently read that about after 10 years, you've got a 95% success rate.
So that's a long time.
I think so. And so, if you look at, most people, if they have a single tooth, they prefer not to have anything come in and out. So prior to dental implants, we would do a bridge where you would shave down the neighboring teeth and take 3 crowns and kind of glue it over the space.
Sure.
We've now made a 1-tooth problem a 3-tooth problem. And at 10 years, about 50% of those fail. So this way, you're restoring a tooth with a tooth.
Right, okay. And technology, right? I mean, that's huge.
The technology as far as what we're doing with implants today, absolutely. I mean, You know, we can take patients who don't have teeth and have teeth that are permanent that don't come out. We can help patients who are struggling to keep a denture in. And then, of course, you know, the patients who have maybe childhood had some dentistry from an accident, midlife, tooth can't make it anymore, it needs to be taken out, it's non-restorable. And so we can insert a dental implant and make it look like it was always there.
Sure. And dental implants aren't necessarily just for an older population, right?
No, no, not at all. Yeah.
Can you elaborate on that for me?
Yeah, you know, I guess a big part of our practice with single tooth implants is, say, someone has a root canal on a tooth, and for whatever reason, the tooth breaks or the tooth doesn't heal properly. That's a wonderful opportunity for, you know, wonderful place for a root canal.
Sure.
So yeah, there's no age. You know, actually, the younger the person, the sooner the person gets in to be evaluated with the bone, the better chances that they'll have long-term success with the implant. Because it's about the foundation.
Sure, sure. Okay. And obviously, I mean, I would assume you treat people who've had horrific accidents too,
Absolutely.
right? I mean,
it could be from trauma. It could, you know, you name it.
Okay.
Absolutely.
All right. Thank you for being here,
So,
doctor.
You're welcome.
So to learn more, head to charlesschof.com, call 985-200-4158, or visit them in person at 240 Dahlwheel Drive in Mandeville.